Physical therapists, you are on the front lines of patient care, spending significant time helping people regain movement and function. You see patients from all walks of life, but let's talk about something that often flies under the radar: metabolic and gastrointestinal disorders. These conditions are incredibly common. They don't just stay within their systems, they impact energy, pain levels, tissue health, and ability to participate and recover from PT. Understanding them is fundamental to safe, effective care. Think about your last few patients: persistent fatigue, fluctuating pain, unexplained weakness. These may be subtle signs of metabolic or GI issues. Ignoring them can cause plateaus, or worse, adverse events. Learning to recognize and manage them elevates your practice. You become a clinician who treats the whole person and builds real trust. So, what exactly are metabolic disorders? Metabolism is the process your body uses to convert food and drink into energy. It's a complex chemical orchestra involving hormones and enzymes. A metabolic disorder occurs when this process goes wrong. This can mean your body gets too much of certain substances, or too little. Think of it like a car engine that's getting the wrong fuel mixture. It might sputter, stall, or overheat. These conditions can affect your energy levels, weight, bone density, nerve function, all of which are critical in a physical therapy context. The most common example you'll see is diabetes mellitus, type 1, type 2. In diabetes, the body has trouble regulating blood sugar, or glucose, because of issues with the hormone insulin. This can lead to hyperglycemia or hypoglycemia. Other metabolic disorders you might encounter include thyroid conditions, hypothyroidism, underactive thyroid, hyperthyroidism, overactive thyroid. The thyroid gland is like the body's thermostat. Patients can experience fatigue, muscle weakness, joint pain, and changes in heart rate. It's crucial to remember these aren't just background diagnoses. So why dasir? These are finite by the per. In dine by restructure door, and not the sea. Finite per se, and dipo per sheer. Ilapasir do por suder di, gendaka crib. Now let's shift our focus to the gastrointestinal, or GI system. GI disorders affect the digestive tract, which runs from the mouth to the anus. This system is responsible for breaking down food, absorbing nutrients, and eliminating waste. When it's not working correctly, consequences extend far beyond an upset stomach. These disorders can be inflammatory, Crohn's disease, ulcerative colitis, or functional, irritable bowel syndrome, or IBS, where the gut doesn't work properly but lacks visible signs of damage. For your patients, these conditions can mean chronic pain, nutrient malabsorption, dehydration, and systemic inflammation. Inflammatory bowel disease includes Crohn's and ulcerative colitis, autoimmune conditions where the immune system attacks the digestive tract, causing chronic inflammation. This can lead to abdominal pain, severe diarrhea, fatigue, and weight loss. Importantly for PTs, IBD is often associated with extra-intestinal manifestations, arthritis affecting the joints, skin conditions, and eye inflammation. A patient might come to you for back pain referred from their inflamed colon, or for joint pain that is a direct result of their IBD. Irritable bowel syndrome is incredibly common. While it doesn't cause tissue damage like IBD, it can be just as debilitating. Patients with IBS experience cramping, abdominal pain, bloating, gas, and diarrhea or constipation. Knowing the definitions is one thing, but recognizing these conditions in action is what truly matters in the clinic. Patients with metabolic or GI disorders often present with symptoms that can easily be mistaken for simple musculoskeletal issues, so you need to be a good detective. A key red flag for metabolic disorders is fatigue that doesn't improve with rest or seems excessive for the activity performed. A patient with uncontrolled diabetes or hypothyroidism might feel completely wiped out after a few simple exercises. Also, watch for unexplained changes in symptoms like sudden weakness, shakiness, sweating, confusion, which could signal hypoglycemia in a diabetic patient. For GI disorders, a patient might mention abdominal pain, cramping, or bloating during your session, especially with activities that engage the core or change intra-abdominal pressure. They might need frequent, urgent bathroom breaks. More subtly, you might notice signs of systemic inflammation. Migratory joint pain, a classic sign of inflammatory arthritis associated with IBD. Low back, hip, or pelvic pain without a clear mechanical cause could be referred pain from the GI tract. Pay close attention to the patient's subjective report. Ask specific questions. Instead of just asking, "How are you feeling?" Try, "How have your energy levels been this week? Have you noticed any digestive issues or abdominal pain since our last session?" Also, be observant. Notice their skin, pale, dry, sweaty. Pallor could indicate anemia. Look for signs of peripheral neuropathy like numbness or tingling in the feet, common in diabetes. When treating a patient with a known metabolic disorder, your primary goals are safety and consistency. For patients with diabetes, this starts with understanding their blood glucose management before starting any session, especially if it's moderate to high intensity. Ask them about their recent blood sugar levels. Ask when they last ate. Ask when they took insulin. Exercise can cause a rapid drop in blood sugar, so you need to be prepared. Keep a source of fast-acting glucose available. Juice, glucose tablets. Store them in the clinic. Educate your patient to check their blood sugar before exercise and after exercise. Teach them to recognize hypoglycemia, shakiness, sweating, dizziness, confusion. Exercise timing and intensity are critical. Avoid exercising during peak insulin times when possible. Consider morning sessions for some patients. Start with lower intensity activities and monitor response before progressing. Include aerobic work, is walking, cycling, and include resistance training. Aerobic improves insulin sensitivity. Resistance increases muscle glucose storage. Check their feet for cuts or sores at every visit. For thyroid disorders, first determine hypo versus hyperthyroidism. Hypothyroidism often causes fatigue, muscle aches, cold intolerance. Pace sessions carefully, include longer rest breaks, progress gradually. Don't push too hard, or they may regress. Hyperthyroidism often causes elevated heart rate and heat intolerance. Monitor vitals, heart rate, blood pressure. Prefer cooler environments and watch cardiovascular response. Treating patients with GI disorders requires a flexible and empathetic approach. Symptoms can fluctuate daily. For someone with IBD or IBS, the first step is open communication. Let them know it's a safe space to talk about their symptoms, pain, fatigue, the need for a bathroom break. On days when they are experiencing a flare-up, high-intensity exercise is off the table. Shift to gentle mobility, diaphragmatic breathing, and stress reduction. Deep breathing calms the nervous system, helping gut motility and reducing pain perception. Be thoughtful with exercise selection. Avoid activities that raise intra-abdominal pressure, heavy lifting with Valsalva, aggressive core work like double leg lifts. These can worsen symptoms. Opt for modifications. For core stability, transverse abdominis activation or gentle pelvic tilts. Chronic abdominal pain often causes a flexed, guarded posture, leading to back pain and hip pain. Gentle stretching for hip flexors and thoracic spine helps. With IBD plus arthritis, manage joint pain and stiffness while considering GI issues. Aquatic therapy is excellent. Buoyancy unloads joints, allowing gentle movement and strengthening. On land, use low-impact activities and joint protection. Monitor energy levels. Pacing is key. Short, frequent bouts over one long session. Consider pelvic floor. Constipation or diarrhea can cause dysfunction. Screen bladder, bowel, and pain. Collaborate or refer to pelvic health PT. No clinician is an island, especially with complex systemic conditions. Your perspective over time provides invaluable information. If you notice red flags like persistent fatigue, signs of hypoglycemia, or a flare-up of GI symptoms, communicate with the PCP, endocrinologist, or gastroenterologist. A simple phone call or a detailed progress note can provide the missing piece of the puzzle for their medical management. When you reach out, be concise and specific. State your role, the patient's name on your clinical findings, and your specific concern. For example, Dr. Nyats, Dr. Smith, this is your name, a PT treating your patient Jane Doe. I'm noticing she's having recurrent episodes of dizziness and shakiness during our sessions, and I'm concerned about potential hypoglycemia. Her next appointment with you is in 3 weeks, and I wanted to bring this to your attention. This guide is a starting point. Keep learning. Attend courses, read journals, and talk to colleagues. Don't be afraid to admit when you don't know. It's okay to tell a patient, "That's a great question, let me do some research, and we can discuss it at our next session." You have the skills to make a profound difference. Integrate metabolic and GI knowledge to treat the whole person. Embrace this role. Be observant, be thoughtful, and be a team player. Your confidence will grow. Now go out there,